it's bad enough when you're healthy, but when you're tired or you're sick or you have a condition, a disease, anything, navigating the US healthcare system can feel impossible. And that encompasses insurance all the way to hospice, basically, right? It just is everything that goes along with our being safe in our space. So that's really, really, it's a struggle right now. I mean, I just called the insurance company this morning because I had an issue about a prescription, and honest to God, I don't think I really got the answer that I was looking for. And I was like, wait a minute. So if I couldn't get the answer, I don't really know who could. I really don't even know who else I would ask. I probably will call back, maybe get another representative. And that's something that I think is good. So, you know, as Cheryl and I were talking, it doesn't always have to be a friend, a relative. There are professional people with the skill set to be an advocate. Okay. So the main role of a health advocate, any advocate, is to assist, educate, and support patients and their families to make appropriate healthcare decisions, but decisions for their specific situation. Okay. Sometimes it's making the appropriate decisions to have further treatment. Sometimes it's making decisions to make a move. Sometimes it's about insurance. I mean, there's a million reasons that we need someone else to have eyes and ears on what we're hearing, because you just walk out of the room and you hear two different things, right? I mean, it's crazy. You hear what you want to hear, which is pretty interesting. Studies have been done where they've taken two people, a patient and the patient's advocate, you know, and they're in a room, and then they walk out of the room and they ask them specific questions, and the answers can be radically different from what the patient heard versus what the advocate heard, because again, we hear what we want, and we want to make sure that all of our questions are answered. Okay. So the role, like I said, is to assist patients in medical, elder care, insurance, legal, administrative areas, and regarding long-term and or acute care needs. So this particular sort of role changes depending if you're in an outpatient clinic setting or an inpatient hospital setting. And I want to touch on that for a minute, because when you are in the hospital, it is your right to receive an advocate, and that advocate shows up in multiple ways as a faith-based social worker, sometimes a nurse, but it is the hospital's responsibility to provide the access to someone for you. They don't do it automatically. You have to ask. But I think it's a good, really, really important to know that once you are admitted to the hospital, you have a lot of rights to have your care someone else is watching out for it. Okay. That is not the case when you are in a clinic just going for a visit to a doctor. And that's why we'll get into a little bit more of the importance of that and how to navigate that particular situation. So there is a very, very, very strong correlation between someone caring about your health, someone being you being accountable to someone. If you are in an appointment with a doctor and you're on a couple of different medications or many medications, if someone else knows those medications that you're on, you will be more accountable to take them. It's just like anything. If we know someone else is kind of watching us, we'll be more accountable. And it's a really, really good thing because medication compliance as we age is not great. It's hard to take all those pills, literally hard to take all those pills. But also, when you're in an office with a doctor or PA, whoever your healthcare provider is, and they are giving you all these things that you should do. You should get this test and this ultrasound and this blood draw. You're like, oh my gosh, okay. And the questions are where, when, how, and you don't, if you don't ask those questions, you may not receive all of that, all of those things that are going to help with your condition. Many, many, many times people will walk out of a visit with a doctor and they're like, do I make the ultrasound appointment? Is someone going to call me? Do I go for a blood draw now? Is someone going to call me? These are all things that someone else sitting there with you, eyes and ears on another for someone else, they can make sure that these questions are answered. They're so, so, so vital to the outcome of whatever you're dealing with. And don't ever be either ashamed or feeling like you don't want to take the provider's time. You don't want to ask the question again. You are there to get treatment. You are there to be told what to do because you're asking these questions. And it should be a dialogue. Many, many, many times you are given instructions on what to do and you have questions about it. There's more than one way to, skin a cat. Do you have to have that blood test today? Can you do it another time? Do you have to have that, ultrasound or that scan within a certain period of time? There's just so many, many, many questions that need to be answered once instructions are given outside of that room. Sometimes they'll say, well, we'd like to get an EKG on you and we'd like to do this. And then okay.
Well, it's every time I go to.
Is that going to happen here? Is that going to happen now? So just make sure that every single word that is spoken from a provider, somebody has, I'll let Kevin go. Make sure that every single word that is spoken from a provider is acknowledged with an answer that you feel complete about it. Okay. You want to make sure that that you have the answer. And then with prescriptions, I think we're going to get to that actually.